Hi, it's Dr. Tim Syed, MD, double board certified plastic surgeon. In this video, we're going to talk about how we help patients select the right breast implants. Now, obviously, it goes without saying that any individual patient seeking breast augmentation needs to be evaluated with a comprehensive consultation in the office with a physical exam and a review of the patient's goals to really personalize the decision. So in this video, I'm going to talk about general principles and how the consultation proceeds in which we help the patient to ultimately make a decision on implant size and style. Today, plastic surgeons have a wider assortment than ever before of different implant styles, shapes, and sizes from 4 major manufacturers: Mentor, Allergan, Sientra, and Ideal Implant, which are the most commonly used implants in the United States. We tend to use a lot of Mentor implants in my practice, but we have the whole array of different implant choices available for specific patients depending on your particular goals. Broadly speaking, implants come in a few major selection categories: saline versus silicone, smooth-shelled versus textured-shelled, round versus anatomic. So we'll talk you through a few of these considerations. First thing I'm going to show you is the difference between saline and silicone implants. Both saline and silicone implants are made with an outer shell that is made of silicone. A saline implant is filled by the surgeon in the operating room with sterile injectable salt water, saline. So it's basically a water balloon that we fill that's sterile and is implanted into the body. A silicone implant has the same type of outer shell but comes pre-filled by the manufacturer with medical-grade silicone. Most of the implants that I use in my practice are smooth-shelled implants for a few reasons. The first is that textured implants have been shown to have a slightly higher rate of capsular contracture when placed under the muscle. The second consideration is that textured implants, because of the manufacturing process, may have a slightly increased risk of rupture. For those reasons, I don't really see a major advantage of texturing for the implants. The third major consideration is round versus anatomic or teardrop-shaped implants. The overwhelming majority of implants that I use and most plastic surgeons use are round devices. They're very durable. They don't carry the same risks of rotating and changing the shape if the implant were to move. And because they're round and manufactured evenly all around the shell, there's less of a risk of leakage or rupture of the device. Anatomic implants may be appropriate in selected cases, particularly patients undergoing breast reconstruction after mastectomy, or patients with a little degree of sagging of the breast who don't want to have a breast lift. When you come in for a consultation, after we take a thorough history and examine you, we're going to take some measurements. So I'll use a caliper like this to actually measure the breast diameter and see how wide an implant your breast can accommodate. We'll also use a tape measure to take measurements of common landmarks, the distance between this point on your chest and each nipple, for example. We put these into a computer program, and then I compare that to the implant manufacturer's catalogs to see what size and style implant might best achieve your cosmetic goals. During the consultation, you'll also be asked to use this sizing kit, and you'll work with one of our patient coordinators to pick out a size that looks good in a tight-fitting bra where you can look in the mirror and see what kind of projection that's going to add. And we like this anatomic sizing kit because it more accurately reflects how an implant will look when it's in the body in terms of changing the shape, rather than just bolting on one of these implants and sticking that into the bra. So this gives you a more accurate representation of how the breast shape will evolve with an implant. They come in multiple different sizes as part of the kit, and you can try on different sizes to help you determine which one is closest to your goal. When you use the sizing kit in the office, we'll have you put the tester implant into a sports bra that fits snugly. That better simulates how the implant will sit under your muscle in your body and give you a better idea of your final shape. The final part of the consultation involves using Chrysalix 3D simulation software, where we take a 3D model of your breasts and then apply different changes depending on whether you need a lift, whether you want saline or silicone implants. We can try on different sizes virtually in the software. When we put all of this together, it helps us formulate a more personalized implant selection process for the patient. For more information, go to our website, timsyedmd.com. Thanks.